How do you properly use shoe lifts and heel lifts for scoliosis? Shoe lifts and heel lifts are devices that are worn inside the shoes to equalize something called a leg length discrepancy, or some type of other structural concern that could possibly be occurring that's leading to a discrepancy in the pelvis. Shoe lifts and heel lifts have to be fully customized, meaning they have to be measured specifically for the person to determine the exact height that needs to be done in order to determine how much they're balancing the pelvis. And normally this is done with x-rays to see how high the heel lift or shoe lift needs to be. A lot of patients may ask, what does leg length have to do with scoliosis? Scoliosis involves the development of an unnatural sideways bending curvature with spinal rotation. And this rotation is typically into the concavity of the scoliosis. Scoliosis can induce a lot of uneven forces to the spine and its surrounding tissues, and the entire body is disrupted in its balance and in its center of gravity. Scoliosis can cause postural changes like uneven shoulders, hips, arms, legs that appear to be hanging at different lengths. And scoliosis can actually change the actual symmetry of the body, so it can affect the length of the legs. And the first way to address a true leg length discrepancy is determining whether is it a structural leg length discrepancy or a functional. Many patients with scoliosis, you'll see one hip that looks higher than the other. And this is sometimes a result of a true structural leg length difference, meaning one leg is actually shorter than the other leg, either in the femur or the tibia. A functional leg length discrepancy is when the pelvis could have a misalignment, but it's not truly a bone difference. And this can make the legs appear at a different length, meaning by the hip level, but it's not truly a result of the bone lengths. Now, how can you tell? The problem is you can't tell just by looking at a patient without x-rays. You have to look at x-rays to determine, is there truly a leg length difference, meaning structurally, or a functional leg length difference? In addition, we also know other deformities can happen as a result of scoliosis, because a true scoliosis is structural, meaning it involves a structural abnormality within the spine itself. And this scoliosis doesn't just change posture, but it changes balance and coordination and gait. So scoliosis can be related to developing a leg length discrepancy, either functional or structural, as a result of disruption of movement and balance, but also by inhibiting growth. When we look at a structural scoliosis, like a structural leg length discrepancy, it is actually within the structure of the spine, meaning as the spine curves and bends, we know that as the body is growing, the shape of the vertebrae can change. And as the shape of the vertebrae change, they lead to the more development of the scoliosis. Well, unfortunately, when patients have scoliosis, their body tends to shift one way or the other. And when they're shifted one way or the other, they could put more weight and pressure on one leg versus the other. And this could be one reason why a patient's leg, one side, can grow slower than the other. So they truly have one leg that's growing faster than the other one because of asymmetrical weight bearing. Also, another consideration, and some theories say, is that maybe there's asymmetrical growth in the growth plates themselves, and the leg length discrepancy is what's causing the scoliosis. And that's another thing that we need to look at when we look at truly a structural deviation in the legs. And the last thing, which even complicates things even further, is not only does a patient with scoliosis can develop a structural leg deficiency, they can develop a structural bone deficiency, but they can also develop a asymmetrical pelvic deficiency, meaning they can have something called pelvic deformity. And when we have pelvic deformity, it means that the pelvis did not come together in a completely symmetrical manner. There's an oblong pelvis that's occurring there. It means that the sacrum and the pelvis didn't fuse symmetrically, and the deficiency may not be in the leg length, but may actually be in the pelvis, causing a sacral tilt. And all these things need to be considered when we look at the pelvis, the legs, in a functional manner and in a structural manner. And unfortunately, we can't say if you have scoliosis, you need to be wearing a heel lift, because the truth of the matter is we don't know what you need based upon until we evaluate all those conditions. However, many patients, if they have a functional problem, we need to deal with the functional concerns. But if they have a structural issue, we need to deal with the structural concerns by normally lifting the leg on one side, either as a result of the leg length deficiency, the pelvic deficiency or the bony deficiency, we have to deal with it normally. And that's normally done with x-rays to determine the exact size. So it has to be customized for that patient. When we look at a functional concern, a lot of patients will be evaluated by like physical therapists or by doctors, and they'll just put their hands on their hips and say, okay, oh, your pelvis looks out of line. This leg is shorter. This leg is longer. And just give them a lift to balance the pelvis visually. That is by far the biggest mistake that can ever be made, because balancing it visually doesn't really determine whether a patient truly has a structural problem. It could be functional. It could just be alignment, meaning the patient, you maybe need some exercises, maybe need some therapy, maybe need some rehabilitation to help balance the pelvis better in space. And the alignment will help the body, or make the pelvis look more aligned. But by addressing it with a leg lift, a functional problem with a lift, dealing with a structural, you may create another problem because they truly don't have a deformity that needs to be done by lifts. Lastly, is legs also grow at different lengths at different times. So maybe one leg can grow a little faster, one grow a little shorter. So this needs to be reevaluated regularly, because sometimes patients may be given the lift, but then we find as we improve the scoliosis and we improve the patient's condition, we know that the discrepancy could sometimes resolve itself, and therefore the lift can be removed. So bottom line, when we look at scoliosis, we know it can disrupt the overall symmetry of the body in many different ways. And when you affect the symmetry of the body, you affect the way the body grows and develops. And this can lead to structural changes and functional changes. And this can be in the legs, it can be in the pelvis, it can be in the bones, or it can be functional within the muscles and tissues with alignment. In any case, the cause of the problem must be addressed and must be customized in how we treat the person based upon their unique presentation. Customized heel lifts and orthotics can help equalize if there's a structural deviation that can't be resolved with just exercise therapy bracing. And we have to really deal with it, because we can't make the leg grow longer or the pelvis grow square once it's already developed in an asymmetrical structural way. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.